My name is James Dracosis and I'm 47. It's been 6 months since I've had a disc replacement, L5-S1. One morning I woke up and I had basically a very stiff back, and I let it go because I thought just work, whatever, and but unfortunately it didn't go away, and that was probably about 9 years ago. The pain, it's a burning sensation. It's located in, basically in my case it was the lower back, but it radiates, so therefore I got numbness in the legs that ran down the back of my leg. I lost some strength. There was pain in my buttocks, backside, groin. I mean, it moved. I went and saw chiropractors, physios, and they basically said it was like a herniated disc at the time. So I still had disc there, but it was herniated. But there was no real solution for it. Probably in the last 3 years, it got at its worst. I ended up sleeping in a recliner because I couldn't lie flat on my back. After a while, I couldn't sit for too long because the pain would kick in. I couldn't stand for more than 10 minutes. The pain would kick in. It affects your sex life. Let's face it, it affects all aspects of your life. You know, it gets to a stage where it becomes unbearable. And then also the fact that if you do take painkillers, where do you draw the line? You have these symptoms, you don't know what the outcome is, you don't know the information, you don't know what to do, and yet you still have to maintain a life. You still have to get up and work, you still got to do all that, and you got to do it with this pain. You know, depression sets in, I'm not going to deny it. It's not just a physical problem, but the mental and emotional side of it is draining to the point where you really don't want to, I won't say live anymore, it's just like you get to a stage where it's like, give me a break. If someone said, your life has to stop, mate, you can't work, you can't socialise, you know, you can't do your sports, you're going to be in pain. You're going to be in pain until you do something about it. Something had to be done. There was no out of it. My life had actually stopped.
This is a real and common story. The intervertebral disc creates space between vertebrae and allows movement and cushioning between these segments in the spine. An injured or diseased disc can become flat, which decreases the space between vertebral segments. This reduces the size of the opening at the side of the spine, causing pressure on nerves as they exit the hole. Injured disc fragments can also press directly onto nerves. This nerve pressure causes pain, changes in sensation and muscle weakness. The aim of a total lumbar disc replacement is to relieve pain by restoring the disc height and relieving pressure on the nerves. The artificial disc comprises two end plates separated by a ball and socket kind of mechanism, which allows movement in all directions, similar to a normal disc. Each end plate has a keel, which allows sturdy fixation. Discs can be made of chrome cobalt, titanium, hardened plastics and hydroxyapatite coatings, which are extremely hard-wearing while providing smooth movement. For disc replacements at the L5-S1 level, a horizontal incision about 10 centimetres long is made in the lower abdomen. For levels above that, the scar will be vertical. The surgeon gains access to the disc by separating, not cutting, abdominal muscles and carefully moving abdominal contents and blood vessels aside. Next, the injured disc is carefully removed and the disc space cleaned. A small groove is cut in the vertebrae above and below the injured disc to accommodate keels in the prosthesis, which hold it in place. The surgeon uses special measuring instruments and an X-ray machine to ensure an exact fit of the new mechanical disc. A trial prosthesis is fitted to confirm a perfect fit. Then the actual implant is secured firmly into position. The wound is closed to complete the procedure, which usually takes about 3.5 hours. An advantage of the disc replacement operation compared to spinal fusion is that it preserves more movement of the spine. These scans show how near normal spinal movement can be preserved with an artificial disc. Possible complications of the operation include, but are not limited to, wound infection, leakage of cerebrospinal fluid from your spine, deep venous thrombosis or blood clots, nerve root injury leading to movement problems, pain, changes in sensation or loss of function, reaction to anaesthetic or drug therapy, retrograde ejaculation from injury to superior hypogastric plexus related to dissection of major blood vessels, sinking of the prosthesis due to osteoporosis, vertebral body fracture, excessive bleeding or injury to the aorta or left and right common iliac arteries, hematoma or bruising, abort the operation due to inability to mobilise blood vessels, post-operative ileus or constipation, injury to the ureters from far lateral dissection, sinking of the disc into the vertebral bodies, and potential risk of joint wear. Some of these conditions are serious and ongoing, while others resolve over time. If you are concerned about possible complications, speak to your surgical team prior to agreeing to have the operation.
These are the things you still have to consider, and it's all part of the decision-making process. So, in my instance, it wasn't even a consideration. I had to get my life back, so no matter which way it went, you know what I mean.
While success rates vary from patient to patient and depend on the circumstances of each individual case, a recent respected study of 108 disc replacement patients found 91% of patients had an excellent result, 7.4% had a good result, and 1.8% a fair outcome. All patients increased range of movement. Conservatively, research suggests there is an 80% chance patients will receive good pain relief from this operation. The goal of surgery is to reduce pain by 80% or better.
It's been 6 months now as such, and I feel like I'm 20, mate. That's the truth. You know, so I'm more than happy. I've got my mobility, I haven't got the pains, I've got the flexibility, and actually it reminds me, because over those years you do lose your flexibility and you forget that becomes the norm for you. Now all of a sudden I'm very flexible, so it was like, yeah, this is phenomenal, so I'm happy with that. The operation wasn't as bad as I thought, the pain level and so forth. Post-op, within 24 hours, the physio actually gets you up and walks you around. So that was the day after. In total, I spent 4 days, I think, in hospital. When you do come home, let's face it, you're pretty drained. I mean, once you get through the initial 4 days in hospital, I mean, you can get around, don't get me wrong, but you're weak. I mean, you know, after you think about it, they separate your spine from your pelvis and they do this thing, and it's just like, it's great, but then the reality does set in. So when you do come home, I wouldn't recommend doing it on your own. You definitely need someone to look after you, bottom line. After 3 weeks, it magically all goes back to normal, and you can feel the difference day by day. And as each day went past, it was just like, oh yeah, this is pretty good. And that's the way it went. While you're in hospital, the physio does come up and they go through, they show you a routine. Now it's up to yourself, but I maintain that routine until today. I've incorporated, as my rehabs continued, I've started from that and I've built on it as I've gotten better. Before the operation I was 89 kilos, and now post-op I'm actually 78 at the moment, and I feel great. I have my life back. That's the best way I can explain it. There's nothing I can and can't do, though there is a 12-month period to an 18-month period where you must take it easy. I mean, I wouldn't wish this on anyone, you know, seriously, you don't kid yourself, it's not a good thing, but it's made me stronger in the sense that I know that I've dealt with it. It's been hard, but now, after all is said and done, my emotional state is phenomenal. I'm happy, I'm hungry for life. I have no regrets at all, not at all. My life's come back, bottom line. You cannot compare. I mean, as far as I'm concerned, I've won the lotto. I get a second lease on life. That's the best way I can explain it.